Good evening, Professor. This time I will talk to you about a panorama of BRCA1 and BRCA2 germline variants in breast and ovarian cancer in Peru. And background study retrospective study that describe pathogenic, probably pathogenic PLP, germline variants and variants of urgentine unknown significance in the BRCA1, BRCA1 and BRCA2 genes in Peru. In patients with breast and ovarian cancer, candidates for treatment with polypolymerase inhibitors and methods patient evaluated in 2019 and 2021 genomic DNA was isolated from peripheral blood samples and targets sequencing was performed using the implicit BRCA panel. Uh, 525 patients were studied, 143 breast cancer and 382 with ovarian cancer. On results, 40.7, 21, 143 of breast cancer patients and 20.7, 79, 382 of ovarian cancer patients were carriers of PLP variants in BRCA1 and 2. In the BRCA1 pathogenic variants, we see all the variants that we see on the screen, and BRC2 pathogenic variants, all the variants that we see equally. VOS, we found that 6.99%, 10 of 143 of patients with breast cancer, and 7.33%, 28 of 382 of patients with ovarian cancer were carriers of VOS in BRCA1 and of 2. I will talk to you about the conclusion of this part of the summary at the end of the video with more detailed information. So, what I explained to you is the summary of the article. Now I will tell you a little more detail about this article, starting with the background. Breast and ovarian cancer are highly prevalent malignant neoplasms in Latin America, where more than 50,000 patients die annually from these pathologies. And mutation in the BRCA1 and BRCA2 genes are the best known genetic risk factor for breast and ovarian cancer. Detection of BRCA1 and 2 mutation allow crucial and challenging decisions regarding cancer risk prevention or reduction, early detection, and pharmacological management. BRCA1 of 2 are tumor suppression genes involved in homologous recombination repair of double-stranded one DNA damage. Several PARP inhibitors have been developed to treat breast, ovarian, pancreatic, and prostate cancer patients with BRCA1 and 2 mutation. Next presentation for ovarian cancer germline testing for BRCA1 of 2 is informative in selecting patients for PARP inhibitor therapy. About 50% of ovarian tumors are homologous recombination deficient HRD, and 20% are associated with BRCA1 and 2 mutation. Treatment with PARP inhibitors is recommended, and maintenance therapy for stage 2 and 4 disease or persistent or recurrent disease in BRCA1 and 2 mutated ovarian cancer. In this slide, we see the methods with the study population where and what year how we observe identifying the candidates for treatment with PARP inhibitors. On the other hand, we see the detection of BRCA1 and 2 mutation be taken peripheral sample and determine the DNA concentration with a fluorometer. The binary focuses of single nucleotide variants, SNVs, and insertion deletion in an exonic region of the BRCA1 and BRCA2 genes and the flanking intronic sequence. In the statistic analysis, a descriptive analysis carried out the frequency of variants identified in the BRCA1 and 2 genes was calculated using ERAS2. Here we find the results with the population mentioned, and we have her clinical characteristics of the patient finding HER2 tumors in different types as we see in the description. In total, 81 of patients with BRCA1 and 2 PLP variants were TNBC and 19% were hormone receptor positive. Only 77 patients had their age available at the time of molecular diagnosis, so the average age was 54.36 years. Starting with the tables, the majority of OCS were high-grade serous carcinomas. The frequency of clinical stage 3 was 33.6% and 50%, and clinical stage 4 was 66.4% and 50% for BC and OC, respectively. On the other hand, is the table the percentage of British Columbia patients carrying BRCA1 and 2 PLP germline variants was 14.7%, of which 61.9% carried variants in the BRCA1 and 38.1% in BRCA2. And the probably pathogenic variants of germline BRCA1, the study identified 33 different germline PLP variants in the BRCA1 genes and 64 patients, finding 20.3% in BC and 79.9% in OC. In this table, we can see which were the most frequent variants in BRCA1. While on this side we see the germline variants according to the place of birth, the PLP variants in BRCA1 predominate in Lima. Maps presenting side counts of pathogenic and likely pathogenic variants in the BRCA1 and BRCA2 proteins. As I said, in this part, we see the BCR2 hemolase variants looking at exon 11 predominant in frame deletion, followed by in frame insertion and missense variants. We also see for ovarian cancer, germline testing for BRCA1 of 2 is informative in selective patients for PARP inhibitor therapy. If we talk about the probably pathogenic variants of BRCA2 from the germline, we find 22 variants of PLP among 36 patients with their most frequent mutation. In another table, we will see for ovarian cancer, germline testing for BRCA1 of 2 is informed in a selecting patient for PARP inhibitor therapy. In the table 4, we summarize and compare our findings with those from other populations. Because we evaluate a very specific group of patients, comparison of the prevalence of PLP variants with other populations would not be a practice. Finally, in the conclusion, in this selected Peruvian population, we found a frequency of 14.7% of germline BCR1 and 2 mutation in BC and 20.7% in OC. The most recurrent root mutation were BRCA1 with its respective variant and BRCA2 with its respective variant. On the other hand, BRCA2 with its respective variant, H. elderly with its respective variant, were not previously reported in Peruvian patients. And BRCA1 with its respective variant is a novel mutation that has not been previously reported in any database.